Hey, Jenny. Number one, I'm sorry that you've been dealing with this for 10 years. I completely understand that. I was in a motor vehicle accident at the age of 16 where there was an injury to my brainstem, and I had significant vestibular dysfunction and migraines that followed that lasted for, until 3 years ago, and I'm currently 46. So from age 10 to age 43. When I tell you that I have now not had a migraine where I was having them weekly and vestibular dysfunction so bad that I shouldn't have been driving a motor vehicle or working with any kind of heavy machinery, I truly, wholly mean that. And I also know that you can solve it. And one of the things that led me to know that I could solve this problem was the extensive amount of training. Over 100 hours of continuing education in vestibular, migraine, and concussion rehab from some of the top migraine and vestibular therapists and physicians, literally physicians teaching physical therapists how to treat these patients in the country. I started down that road of treating vestibular dysfunction, concussions, and migraines a little over a decade ago because of a need in my community, and was very successful at it, but wasn't implementing all the strategies that I think I could have until really about 5 years ago when my son was having debilitating migraines. And within 6 months, we were able to solve his migraine issue. And that led me to thinking, I wonder if I could solve mine. And was able to do that. I had a breakthrough migraine 3 years ago after not having one for 2 years, and since have not had one for 3 years. My migraines, because my vestibular dysfunction is brainstem related, were what triggered my vertigo. So every week I was having a vertiginous episode. There are a ton of causes for vertigo. And yes, if you have benign paroxysmal positional vertigo, we take caffeine, alcohol, salt, and tobacco out of the diet. Absolutely, 100%. But not every other vestibular patient needs to take caffeine out of the diet because it's not a trigger for them. They don't need to take out tobacco because it's not a trigger for them. They don't need to take out salt because it's not a trigger for them. I think they should all take out alcohol, but that's just my personal belief. And I think they should also probably take out tobacco, but that's also a belief system. There is some research to back it up, but there's also some research that proves that nicotine is needed by the body and actually helped prevent severe cases of COVID in patients who smoked. The bigger question I have for you is, why haven't they solved your migraines? Why haven't they solved your vestibular dysfunction? Because the ones that I consider super difficult are the ones that have had a stroke, a severe concussion, or a brainstem disorder like I had. Those are the ones that are more difficult. Benign paroxysmal positional vertigo is not hard to solve, and in fact can be solved by most people on their own in the comfort of their living room. Which is why also when a doctor puts vertigo as a diagnosis code, the insurance company often only authorizes one visit for physical therapy. The systems that play into vertigo, the inner ear, obviously, it's your gyroscope, but then it's also every joint in your body. It's also your eyes, and then it's the computing software that sits on the brainstem called the vestibular nuclei, which is where all the information gets sent, interpreted, and then tells the brain what's up and what's down. This is a specific area of my concussion and why I struggled with vertigo and then migraines that were so intense. And some people are going to come back at this and say, my migraines are hormonal. Well, that's because your hormones are having huge shifts when they should be more undulating, and we can fix that too. There may be dietary triggers, but a lot of those dietary triggers are the same as food allergies that pop up random and new, where you're actually deficient in a mineral or a vitamin or an enzyme. If we can fix those deficiencies, we can fix the dizziness and we can fix the migraines. In the past 5 years, working with clients in this way, I have been able to help them eliminate migraines, eliminate vestibular dysfunction, and live a more normal life on a daily basis. And this is literally coming from somebody who suffered migraines weekly to the point of vomiting a few times a week because the pain was so intense, and still having to go to work every day and work with clients and pretend I was okay. And not every case is the same, but when somebody asked me, what are you doing in this course? One of the professors asked me, what are you doing to manage your migraines if none of the migraine medications work for you? And I said, I'm doing an iced coffee as fast as I can. I keep them in the fridge at work. As soon as I start to notice my first symptom, 500 milligrams of Tylenol and 600 milligrams of ibuprofen. And they're like, where'd you hear that? And I said, I didn't hear it anywhere. It's just a cocktail that worked for me. And so I've kept doing it. And they were like, that's brilliant. That is the field medicine response for a migraine. One of them even brought out an old textbook. The thing looked like it was written in the 60s, where it talks about caffeine and even caffeine infusions for patients experiencing a severe migraine, because the goal is to change the blood pressure, because a blood pressure change is the migraine. The headache is a symptom of the blood pressure change. It is not the migraine. The migraine is actually the change in blood pressure. That change in blood pressure can also affect what's happening at the brainstem level, which then can affect vertigo. So if that's the type of vertigo you have, and for some reason you're shifting blood pressure too often, we know that we can fix it because we can fix the systemic thing that's going wrong that's making your blood pressure shift so rapidly. But that's just from my perspective and what I've learned in spending countless hours, over 100, studying with some of the top migraine and vestibular and concussion physicians in the country, as well as physical therapists in the country, and learning from them and learning the functional medicine side of what happens when things go wrong in the different processes and enzymatic things that should be happening that aren't happening in the way that we break down foods, and solving migraines first within my own family and then extending it out to patients. I hope this helps.